Okay, it's 11:31. Let's proceed. Welcome everybody to the Henry Ford Health System COVID update with Dr. Adnan Munkarah, Executive Vice President, Chief Clinical Officer for Henry Ford Health System. Thank you, Dr. Munkarah, for joining us today.
Thank you, Tammy, and good morning, everyone. We'll start our update by giving you some reflections on what we are seeing as far as data and numbers with respect to COVID. Unfortunately, as you well know, we continue to see record numbers of deaths and infections nationally. And this is really very saddening, and we are hoping to start seeing some leveling off of these numbers. Fortunately, we are starting to see some leveling off in Michigan. So we have seen that the numbers, both of people who are testing positive has started to come down, although the number that we saw from yesterday is concerning with respect to the number of deaths that we have seen. We are hoping that this is just one blip, and we are going to go back to the trend that we have been seeing over the past few days. We are confident that some of the numbers that we are seeing in Michigan and some of this leveling off is related to all the hard work that everyone has been involved with in the community to make sure that we are following all the measures that we have asked the community to follow, which is to continue to wear masks, to social distance, to avoid gathering, and to wash our hands. With that said, I want to remind also people that as we are approaching another 2 weeks of holidays, starting today with Hanukkah and then approaching the rest of holidays, including Christmas and New Year's, sometimes our tendency is to say, well, the numbers are coming down, we are safe, and let's get together. I would really warn us not to do that, because if we look at our positivity rate among the population, it continues to be high. It continues when we are testing people out there today, the numbers continue to be double-digit positivity rate, percentage rate, which is significantly higher than what we had a couple of months ago during the summer when our numbers were much better. With respect to Henry Ford hospitals, we are also pleased to see that the numbers of inpatients admitted with COVID has also dropped down over the past few days. As of this morning, we had 308 patients who are COVID positive who are admitted to our 5 acute care hospitals. This is almost a 15% drop in the number of COVID positive admissions in the past week. However, we still have patients, in addition to the 308 patients that we have that I have mentioned, we have another 145 who are on droplet isolation. Some of them have COVID tests pending, others are suspected to have COVID and as treated as such. The other good news that we are starting to see is the number of employees who are testing positive is also coming down. So while we were about 150 employees testing positive 2 weeks ago, we were 136 last week, 3 weeks ago we were at 150, 2 weeks ago we were 136, and in this past week we had 112 employees who tested positive. So this is again a reflection of what we are seeing in the community. As you remember, we have mentioned before that the majority of our employees who are testing positive are catching the infection in the community. And with the numbers of positivity in the community is coming down based on all the protective measures that the community has been taking, this has been reflected also in the number of people who are testing positive. However, unfortunately, because of the fact that we had high numbers in the past few weeks with respect to employees testing positive, we still have a large number of employees who are off work because they have either tested positive and they are still out sick or on quarantine or have pending tests. As of today, we have 686 employees who are off work related to COVID-related illnesses and or testing. This was 576 last Friday. So as you can imagine, we continue to be significantly concerned about our shortage in workforce, and especially these frontline workers who need to take care of our patients, COVID and non-COVID patients. And as you can imagine, fatigue is setting in, and we are doing everything possible to support our workers. But most importantly, the best thing that we can do is make sure that we are able to control the infection in the community so that we have less employees testing positive and accordingly less employees who are off work. I want to have a shout out at the present time to our colleagues and partners at Northwell Health in New York. Through arrangements and discussions that we've had with them for the past few months, we are so grateful to have 12 of their nurses, ICU nurses, who traveled to Detroit a few days ago to be with us over the next couple of weeks to provide some relief to our ICU nurses. These nurses are deployed currently at our Henry Ford Hospital campus as well as Henry Ford Macomb. And I can tell you, I've had the pleasure to meet some of these nurses, and they are absolutely wonderful, inspirational. When we asked them, why did you come here? They said, this was a no-brainer. You needed help, and we understand when we were under significant stress in the spring, we needed help, and we know how it feels when there is stress related to COVID. So we are ever thankful to them, and we promise that they ever need our help, we are going to be there for them like they are here for us now. The last thing I want to touch upon with respect to this topic is the fact that we are also glad to see that the number of flu cases continue to be very low in the state and in the region. And this is very helpful because, as you can imagine, we have talked before about the significant harm that we would have seen if we had superimposed on a COVID surge, a significant flu surge. And there is no question that the protective measures that have been taken to protect us with COVID are protecting us now with the flu. And many people have taken their flu shots. And for those who have not taken it, please, a reminder, as we are approaching the holiday season, go and get your flu shot. Next topic I wanted to give you a quick update on is our Tough Love campaign. Last week, as you have seen, we have launched the Tough Love campaign. It's a public awareness campaign to remind people that we need to continue to be strong, to stay tough in our fight against COVID, to wear a mask, to social distance, to wash our hands, and to make sure that we avoid indoor gathering. We are very excited about that, and very excited about the 260,000 masks that we have distributed through Detroit and Jackson to our community to protect them during the holiday season. The Tough Love campaign uses images from our community, from Michiganders, from our healthcare workers who have been resilient in their fight against COVID, persistent and courageous in making sure that we do what is right to take care of our patient. So we are hoping that this campaign has found its place in the heart of our community, and people are using the information there to be inspired by the community, by the tough Michiganders, as well as our heroes in healthcare. Continuing our needed healthcare. You've heard from us before that it is absolutely essential and important that we do not delay care. We have continued to have our doors open to make sure that non-COVID related care is delivered to our patients in all the venues that they need it, on the inpatient side and in the ambulatory settings. We also have continued to ramp up our virtual care. We have tried by all means not to cancel any healthcare related service, whether it's a procedure or a visit as needed. And there are times where we might have postponed some care just for a couple of days, but we were able to flex our services so we make sure that the patients are getting the care that they need in a timely fashion. We have continued to take every single measure to make sure that our facilities are safe, our staff are safe, and that we are providing everyone with the PPE they need to take care of the patient and to protect themselves. It is far more risky to delay needed health care than to go to a healthcare facility at the present time. We know that it is our natural instinct and inclination when we hear about the COVID cases to avoid going to see our doctor, or to avoid going to go have a procedure, to have that screening test for breast cancer or for colon cancer or for lung cancer, or to have a highly needed visit to recheck the blood pressure or to check our blood sugar. I really want to encourage all of us to seek our healthcare as we need it, because the consequences and the effect of not getting the care in a timely fashion are more risky and have much worse impact on our health than the risk of catching COVID. We know that there are certain measures that protect us from catching COVID. We know that wearing a mask, social distancing, things that we have implemented in our facilities have been extremely successful. So please do not delay your care and make sure that you get it whenever you need it. I know the talk of the day is vaccines. We have talked to you before that we are extremely excited about what we are seeing with the vaccines. Yesterday, the advisory committee advised the FDA to go ahead and approve the emergency use authorization for the Pfizer vaccine, and we are very excited about these news. We also received information yesterday and news that all our 5 hospitals, which are all equipped with ultra-cold freezers, will be receiving their first batch of vaccine early next week. We understand that between December 15th and December 17th, each of our hospitals will be receiving 975 doses. This includes Henry Ford Hospital in Detroit, Henry Ford Wyandotte in Wyandotte, Henry Ford Macomb in Macomb, and Henry Ford West Bloomfield in West Bloomfield, Henry Ford Allegiance in Jackson. All of these hospitals have been ready for for days and weeks now to receive these vaccines. The total vaccines that we'll be getting is a total of 4,875 doses, according to the information we got from the Michigan Department of Health yesterday. We've also been preparing for a long time at the present time, for a long time of how we are going to proceed with that. We've been monitoring the CDC guidelines. We've been listening to the Advisory Committee on Immunization Practices to determine how to prioritize our vaccination. As you have heard, per the CDC guidelines, the healthcare workers who are involved in aerosol generating procedures are the highest at risk to develop the coronavirus. So these will be some of the healthcare workers who are on top of our priority list. As we've gone through our priority list, looking at people who are at high risk for exposure within our facilities, we've identified close to 4,700 team members who we believe will be in the phase 1A of this vaccination. So we have put that list together. We are working very closely between our infection control leadership, with our employee health, as well as with our vaccine committee, to make sure that we have all the logistics and operational steps that are needed to extend appointments for these staff members and offer to them the vaccine as soon as we get it. Again, we are expecting this early next week. We know that this is not sufficient to vaccinate all the healthcare workers in our system. We have in excess of 25,000 Henry Ford Health System team members who are in positions where they have regular interaction with patients. And we are hoping that within the next few weeks, as the production of vaccines ramp up, we'll be able to get all the doses that are needed to vaccinate all of these people who are at risk of being exposed to the virus. We also have been told that since we have the ultra-cold freezers, we'll be getting more and more Pfizer vaccines. And we continue to be in constant communication with the Michigan Department of Health and Human Services, as well as tracking what the CDC recommendation and requirement are. We'll be very excited when Moderna also get their FDA approval for EUA, because this is going to increase the number of vaccines that will be available to the state, to the nation, and to all of us. So how this will be allocated, we are continuing to track it and work with these different health authorities to make sure that we have all what we need, one, to protect our healthcare workers, to protect our vulnerable population, and then to protect the community at large. We have also been assured by the Michigan Department of Health through the CDC that once we receive the first doses of the vaccine, we'll also be receiving within 3 weeks the second dose that is needed to vaccinate these individuals who were vaccinated the first time. So this means that the initial batch that we'll be getting of the vaccine will be able to all go to vaccinate all team members, and then we'll be getting another allocation, another batch in a couple of weeks to make sure that those same individuals are going to be able to get their second dose. As far as encouraging our community to get the vaccine. We have been tracking the data. We've gone on the FDA website and we have looked at the data that is now publicly available. We are confident in the recommendation that the committee has given with respect to the safety and the efficacy of the vaccine. And this is why we have embarked to say we are going to go ahead and provide the vaccine. At the present time, we are not mandating the vaccine. We are strongly encouraging our team members to take it, but we are not mandating it. We respect people's right to choose, and at the present time where we do not have enough vaccines, and we know that people want to learn more and more about the vaccine and its side effects, we want to respect that. And we will continue to work with all our team members, our community, as well as healthcare agencies to make sure that we are educating, answering questions, being transparent about what we know and what we see in order to build the confidence among our team members as well as the community about the need to get the vaccine. So we believe that it is not only the logistics and operations regarding the vaccine, but the communication, the education, the advocacy is going to be extremely important. We fully respect that people are concerned about the fact that there were a lot of politicization and politics around the vaccine. We assure you that based on all what we have seen and what we have reviewed at the present time, that the vaccine development, the clinical trials that have been designed, as well as the data that has been made public, follow every single scientific evidence that we need for any drug and for any vaccine. So this is why we are confident at the present time into the data that we have regarding the Pfizer vaccine. We have heard and seen initial data that is very promising about Moderna vaccine, and we hope to see the same in the next week. And we continue to be optimistic, encouraged, and very optimistic of where we need to go. With that said, vaccinating, whether people get vaccinated or not, we cannot lower our guards. It's going to take us some time to vaccinate enough people to develop that herd immunity in the community in order for us to get a significant control on that virus, that we are not risking the lives and health of people. So while we are at the present time vaccinating people, our expectations for wearing masks, social distancing, hand hygiene, as well as avoid internal gathering are going to continue to be the same until we feel that over the next few months, we have enough percentage of the community who are vaccinated in order for us to provide the protection that the community needs. We also have learned from the data that's available through CDC and the FDA that these vaccines are going to have some side effects. People are going to develop fever, usually it's mild, as well as flu-like symptoms. They might not feel good for a day or two. And we understand that, and we are trying to monitor these data and as well as educate people that they are going to get that. And we are going to have open line of communication for our employees who get the vaccine, and if they have concern about these side effects, to contact us and seek the advice that they need. We are also very excited to share with you that we have been in work with the city of Detroit to assist them in vaccinating their first responders and other emergency personnel. These are part of the healthcare work teams. These are people who help transport and take care of sick individuals within the community, and we want to make sure that they are as protected as well. So we are happy to provide the expertise to the city to make that happen. And we understand that there are specific allocations that will be coming to these groups in addition to the allocation we'll be getting, meaning allocation coming to the city to help vaccinate our first responders. So we'll be working with them to set the logistics and operation for vaccinating and immunizing our partners in those areas. And before I take your questions, I just want to make a few more points. You've heard from me before. I have continued, and we have continued as a team to be extremely optimistic where we are. This is an amazing period of time. We've gone through really a health crisis like never seen before. But we also have seen the development of a vaccine at a speed that we have never seen before, and that nobody would have imagined, few months ago that we'll have 2 vaccines that are proven to be very efficacious. So we need to be celebrating this, and we need to be very excited about it. And there is no question in my mind that 2021 will be a much better year than 2020. But our plea to you also is that it is going to get us some time to be immune and to have our defense systems in our bodies high enough to fight this virus. And if we don't continue to take care over the next few weeks, especially during this holiday season, we are at risk to see again record numbers of infected people as well as death. We do not want to have 2020 end up with a number of deaths that all of us are going to look at and be very sad about. We already have seen enough, and we want to stop what we have seen so far. So our plea to you is to, as we have said it in our Tough Love campaign, you've been tough, you've been a loving community, you have loved ones that you care for. Let's protect them during this holiday season by continuing to be by continuing to be tough, by being resilient. Let's wear our masks. Let's social distance. Let's wash our hands. Let's do virtual holidays this year so that next year we are back together around that dinner table, celebrating together, hugging each other, and thinking about the past year that have gone behind and that hopefully we'll never see again. I wish all of you, if I don't have the chance to connect with you in the next week or so, very happy holidays, and I'm happy to take questions now.
Thank you, Dr. Munkarah. We appreciate that information. One clarification I wanted to ask you about, you mentioned aerosol generating procedures, and the folks that are performing those would be prioritized for the first vaccines. Could you describe what aerosol generating procedures are?
These are procedures that we usually do where we expect that people are going to be coughing, sneezing, breathing heavily, where we have droplets, even there might be small droplets of saliva or sputum that are up in the air, and these are the things that will carry the virus in them.
Okay, thank you. We have a question from Rod Maloney. Rod, could you go ahead and ask your question?
Yeah, hi, doctor. I was looking at the numbers, and the number that jumped out at me most was the 16,828 hospital beds of 24,000 across the state. Is that accurate? And am I reading it properly? And how does that square with your optimism that things are improving?
So I'm going to kind of check on these numbers. I looked at them from, I know they were provided through our registry for the state. Now, when we are looking, this does not mean that all of these are occupied by COVID-related patients. So I can tell you, for example, within our system and what we've heard from other healthcare systems, that the number of, in general, again, this varies by hospital, the number of beds that are occupied at the present time by COVID-related patients are anything between 25 and 30% in general. So the 16,000 bed does not mean 16,000 bed occupied does not mean that they are all COVID-related patients.
Okay.
Does that answer your question, Rod?
Yes.
Okay, thank you. We have another question. Robin Bird?
Hello, can you hear me okay?
Yes, go ahead.
It's just a couple of points of clarification. You know, you said you're getting these 975, the first shipments for each of the 5 hospitals. To whom do you communicate with that? Is that from Pfizer? Is it from the CDC? Is it from the state? So that's the first quick question. And then I know this is very early, but can you talk to me a little bit about, I mean, have they given you an idea about whether shipments will come regularly after that? Are you kind of at the mercy of the rest of the distribution chain? What happens after the first 5 shipments?
What we have learned, what we have heard is what we've heard, the allocation is from the state, that this is what we'll be getting. And this has been kind of our essentially point of communication, because all of these vaccines are coming from the CDC, the state knows about them, and then we know what we'll be getting. We also have heard, at least as of a few days ago, that the state will expect shipment of vaccines over the next few weeks on a weekly basis. This will depend really on the Moderna getting their EUA, their emergency use authorization. So all of these projections are based on the fact that we'll be getting some Pfizer vaccination. We said we're getting these allotted doses now. We know that we'll be getting another similar number in 2 to 3 weeks to make sure that we get the second dosing for those individuals who have vaccinated first. And then we understand that once Moderna also gets the EUA, they will also be shipping some vaccines to the state. We don't know the exact numbers yet, but this is what we've heard so far.
Thanks, Dr. Munkarah. We have another question from Will Callan. Will, in your outlet, please. Robbins with Bridge Magazine.
Will, you're on mute.
Will, you there?
Cannot hear you.
Let's see. Okay, Will, can we, oh, he's off mute, but we still can't hear. You know what, let's go on to Michael Thomas, and we'll circle back to Will. Michael?
Hi, good afternoon, everyone, or good morning. I do know overseas, the UK has been having some side effects and things like that. Will there be any advisements from you all for people who may have allergic, reactions to certain things, where maybe you guys advise them do not take this vaccine because it will act up for any of your allergies that you may have? Because it looks like that's what's going on overseas right now in the UK.
And what outlet are you from, Michael?
WLNS 6 News in Lansing.
Thank you.
So what we have learned, Michael, is that people with severe allergies, and this is not, who have developed severe allergic reactions in the past, might have shown a higher risk of reaction to these vaccines. We know that these vaccines are what we call highly reactogenic, meaning that people are going, the chances of them, of people who get this vaccine, developing muscle aches, general body aches, fever is higher than we have seen with the flu vaccine. And these symptoms might be more severe by people who have a higher tendency to have severe allergies. But this does not mean that somebody who has mild allergy or have had a rash related to a medication or a drug or have mild seasonal allergies will not be given the chance or will not be offered the vaccine. We do not believe that this will be what we call a contraindication or exclusion for the vaccine.
Okay, thank you so much.
We have the question from Will. Will's mic's not working, but he asked if you could answer this question for him, please. He's with Michigan Radio. Are COVID hospitalizations on the rise in any Henry Ford hospital? When would we start seeing the effects of Thanksgiving gatherings on hospitalizations?
Yeah. Thank you, Will. So our numbers have not been on the rise. They have been either steady or slightly declining over the past 3 to 4 days now across our hospitals since the beginning of the week, in fact. We still have hospitals that have very high numbers. For example, Henry Ford Macomb still have we have 106 or 107 COVID positive patients and then additional patients who are droplet positive. We are now about 2 weeks since we have had Thanksgiving, the Thanksgiving holidays. So if people got exposed to the virus at that time, they would have started to show symptoms or signs by now and would have seen some surge. The problem, remember that it is not like a day-to-day. So people might have had the exposure following the Thanksgiving, 2 or 3 or 4 days. So we are not out of the woods yet, but definitely the news that we've not seen a significant surge at the present time is reassuring. What we are hoping is that this does not mean that people will lower their guards and they will say, well, things went well with Thanksgiving, so let's gather together around Christmas or New Year's. If you look at the numbers nationally, they are staggering. They are really scary. They are extremely saddening. And we don't want to be in any situation in Michigan where we are seeing a rise just around or after the holidays that we'll be celebrating in the next few days.
Thank you, Dr. Munkarah. Will gave the thumbs up. We have a question too from Kim Russell from Channel 7 WXYZ. She asked, what is the hospital's capacity for handling the Pfizer vaccines? How many can be stored for distribution at a time? And how long are you projecting it will take before the frontline workers have been vaccinated, if they wish, and it moves to the public?
So with respect to how much we can take as far as vaccines, I know that at Henry Ford Hospital we have 2 of the ultra cold freezers, and I know that these can accommodate thousands of dosages in that respect. We can give, I don't know exactly the exact numbers, but we are happy to kind of check with pharmacy and share that with you. With respect to how long would it take us to vaccinate all of our healthcare workers. So at Henry Ford Health System, we have a total of 33,000 healthcare workers. About 25,000 of them are in direct patient direct patient-related activities. And these are the people we feel that we need to vaccinate. We really do not know the exact time that we'll get the additional dosages to vaccinate more people. What we have heard is that as Pfizer and Moderna continue to ramp up, hopefully between now and the first quarter of 2021, January, February, we'll have enough dosages, not only to vaccinate the healthcare workers, but also to expand it to the population beyond the healthcare workers. But we continue to track the numbers because these numbers honestly are fluid, and we are still waiting to see what Moderna will be able to drive in the next 2 weeks.
Thank you. Robin Erb from Bridge Magazine has another question. Robin, go ahead with your question if you could.
Thanks. And I apologize. Yeah, I'm with Bridge. I forgot to tell you that earlier. Just a minor question. When we're talking about the healthcare workers that are in that direct care and with those aerosol producing, tasks, care, I think we all think of the respiratory therapist, but I'm just trying to brainstorm. Who would some other workers be, or what are some of the other procedures that are in that produce those aerosols? And thank you.
So we've done it. So it is the aerosol producing does not mean necessarily it is just when somebody is the person who is doing the procedure, but everybody who is around in that unit. So when we are looking at the things, we are looking more at the units that people are. So we look, for example, an intensive care unit. It is not only the respiratory therapist who is going to be getting this. It is the clinical, it's our nurses, it's nurse aides, our environmental services, our desk, our secretaries and assistants, because they are in that environment. So we are not looking at it from a job description perspective. We are looking at it from a unit perspective. What are the units where we have exposure? And everybody is going to get that vaccine in those units.
Thank you. We have a question from Mark Cavett. Mark?
Yes, doctor. I just want to confirm the 975 doses per system hospital that you said that will be initially received. Is that correct? 975 doses beginning next week per hospital?
Correct.
Okay. Thank you.
And Mark's with the Oakland Press. I don't see any additional questions. Oh, we have one from Kim Russell. Kim, go ahead and ask your question if you could, please.
Dr. Munkarah, even if the hospital system is working everything out, what are some of the biggest logistical challenges that people should just know about the work that you guys are doing as you are preparing for more and more vaccines and a larger distribution in the future?
So Kim, as you can imagine, what we're trying to do is vaccinate as many people as we can within a short period of time. Our employee health departments have not been set to do that. We do usually this, we stagger the flu vaccines around the year, and now we have to vaccinate as many people as we can with a totally different new vaccine. Remember, these need to be frozen in a certain place. Once they get out of that freezing, they need to be reconstituted, so that the pharmacists need to be involved. We need to make sure that we have all the measures that are needed to make sure that the vaccine is effective when it gets to the people that we need to vaccinate at that time. And then we need to have enough areas that are set to kind of vaccinate that large number of people, because we need to give the vaccine within a shorter period of time in that respect. So we need to have enough staff to do that. We need to make sure that we are available for people to answer their questions, because people are going to be concerned now. While I have the symptoms with the flu vaccines, we all got used to it. We take it, we know what we're going to feel, and we are okay with it. With the COVID vaccines, we anticipate that more people might have more questions in that respect, to make sure that we are where we need that we are able to address their concern and their question in that respect. So these are the things that we need to kind of be working on and continue to work on going forward. And the other thing is that the uncertainty. We know that we are going to get these vaccines, as we have mentioned. We were told that we'll be getting vaccines, hopefully week after week, but also trying to get people to say, well, I got the vaccine, but my next door worker and colleague did not get the vaccine. When will they get the vaccine? So communication, making sure that we are communicating well and responding to the concerns that our staff is going to be extremely, extremely important going forward.
Thank you. I don't see any other questions. Mark Cavett has another question. Mark, go ahead and ask your question.
Yes, hi. How will employees be notified if they are eligible to receive the initial doses? Will they be sent an email and asked to sign up for a day and time?
So definitely we are working on emails, we are working on communication, we are also working on automatic scheduling where people can do it electronically, like we do with some of our clinic visits where people can log in and do the primary appointment setting. So this is at the present time developing all of these at the same time and making sure that we have all the necessary slots needed. As we have mentioned, we did not know how many vaccines we were getting till last night. So now we have the numbers, we know the number of slots that we are going to need and how we are going to kind of, divide this between electronic or electronic booking versus communicating by email and receiving phone calls.
Okay, thank you. And we're just to reiterate, this is an emphasis on the frontline healthcare workers that we're scheduling first, correct?
That's absolutely correct, Tammy, because at the present time, it is what we have, the doses that we have are for the healthcare workers. And as we said, we will be working with the city of Detroit to be working also, to be also helping them with first responders. But we understand, getting their own allocation and allotment of vaccines.
Okay, great. I don't see any other questions. I also want to share with our media friends that we do have B-roll available upon request of the freezers, the vaccine, and interviews with pharmacy leaders. So if you'd like to email mediarelations@hfhs.org if you're interested, we can go ahead and honor your request. With that, I think we're good. I don't see any other questions in the chat. Thank you again so much, Dr. Munkarah. Everyone, happy holidays. And we appreciate you tuning in, and we appreciate the information, Dr. Munkarah. Have a good day.
Thank you, Tammy. Stay well and happy holidays.
You too.